Good afternoon. Thank you for joining us for Connections Between Racism and Health, Taking Action. The webinar will begin shortly. We want to give a few more people an opportunity to join before we get started. We'll start in just a moment. All right, I think we can start.
Great. This is Pat T-Berry, President and CEO of the Ohio Business Roundtable. I'd like to thank all of you for joining this call today for this really important discussion. It was about a year ago in Cleveland, Ohio at our annual meeting that Randy Ostra, the CEO and President of ProMedica Hospital, brought to our attention an incredible discussion on the social determinants of health 1 year ago. And as terrible as 2020 has been, if there is a silver lining that has come out of it, it's that we have all become much more introspective, requiring us to examine and re-examine traditional policies and practices throughout our state, throughout our society, including businesses, government, education leaders, and certainly our healthcare system, just to name a few. Obviously, 2020 has brought upon us all a heightened awareness and sensitivity to racial issues. And today, the Ohio Business Roundtable is proud to partner with the Columbus Partnership and the Health Policy Institute of Ohio to examine how we can create a more equitable healthcare delivery system. Over the past 7 months, members of the Ohio Business Roundtable have shown incredible interest in learning more about how we can become better leaders on racial justice. And a number of our members are recognized nationally for their inclusive policies and practices in their operations. And while the pandemic continues to disproportionately impact minority populations, I'm proud to be part of an organization whose members work tirelessly to reverse this trend and break down barriers that adversely impact minority health. It's my pleasure to introduce a partner, Alex Fisher, President and CEO of the Columbus Partnership, and thank the partnership for its leadership on issues pertaining to race and equity. As most of you know, the partnership was formed nearly 20 years ago, 18 in fact, and the best 9 have been since Alex took over 9 years ago. Over 9 years ago. Gosh, it's been 11 years, 2009, right, Alex?
That's right.
The partnership was originally formed by Les Wexner and John F. Wolf, business leaders in Columbus, to improve the economic and cultural base of Central Ohio. And over the course of the nearly past 2 decades, the partnership has done so much to create an environment for businesses to thrive, but also the partnership has helped improve the quality of life of its residents in Columbus and Central Ohio by taking stands on social and cultural issues to create a more inclusive Central Ohio community. And though he's a native of Tennessee, there's no more proud Ohioan than Alex Fisher. Please welcome my friend, Alex Fisher.
Thank you, Pat, and it's great to be with everybody for this important conversation, a conversation that I would encourage everybody to, put your heart on the table and be vulnerable. Think about how we can learn today. Think about how we can stretch our own leadership. Pat, that's exactly what you've been doing at the Ohio Business Roundtable, with business leaders across the state. Always challenging each and every one of us to think about how we can get better, how we can become stronger, how we can lead Ohio into the future. And in this year, 2020, there's never been a more important work, both at the Ohio Business Roundtable and at the Columbus Partnership, where we have CEO leaders who come to both of our tables and leave their selfish interest at the door and bring their community interest to the table, solving tough community problems that face our state, that face our individual communities. And what a decade it's actually been, both for Ohio and for Columbus. But oh, what a reminder this year is and how much progress we still have to do. And it is with that spirit, a spirit that is an attitude of we must tackle these challenges, a recognition that we as business leaders are not only not afraid to say, but it's important that we continue to acknowledge that systemic racism is real, that the issues of white privilege are prevalent, and we've got to have honest, open conversations so that we use this unique time in the year 2020 to make not only changes in our companies, but changes in our community and indeed changes in society. And that's what we're committed to at the partnership. Mike Kaufman and Kurt Moody, two of our members, are spending a lot of effort co-chairing what we think is not going to be a 3-month study. It's going to be 3 years of work into infinity, a permanent conversation about the things that all of us can do as business leaders to continue to learn, improve, and use this moment in 2020 for real sustainable change. And to that end, we bring this program, Taking Action, the connections between racism and health. Never have we seen two more important and challenging issues that are inextricably linked, that are tied together. And really welcome a special guest, Amy McGee, who is the president and CEO of the Health Policy Institute of Ohio. She has a decade of experience working in this organization, advising policymakers in Ohio, but she's also got a lot of experience in both the executive and legislative branches. And perhaps there is no more important health crisis that our country and certainly Ohio and Columbus have ever faced than this issue of racism as a public health crisis. So Amy, we are thrilled to have you with us as this is one of many learnings that we're seeking to undertake as we look to the best ideas that we can bring home to our community and to our businesses. Amy's a proud alumnus of the Ohio State University. She's a distinguished William Oxley Thompson Alumni Award winner. Amy, we appreciate your service to Ohio and perhaps this moment in time, never more important. So Amy, we look forward to the discussion.
Wonderful. Well, thank you, Alex, for that introduction, and thank you to both you and to Congressman Teaberry for the opportunity to discuss the relationship between racism and health and to share a framework we've developed for taking action to eliminate racism and advance health and equity. I'm joined today by Reem Ali, my colleague at HPIO. She is a vice president in our organization, and she's been with HPIO almost as long as I have, a little over 9 years, I believe. Among many other projects, Reem also leads our equity work and our work focused on the connections between racism and health. The vision for our organization, and I'm sure this is a vision that many of you share, is that Ohio is a model of health, well-being, and economic vitality. Our contribution to that vision is through our mission, which is to provide the independent, and nonpartisan analysis needed to create evidence-informed state health policy. As you alluded to, our work is centered on policymakers in both the executive and the legislative branches. However, we do our work in strong partnership with the private sector because we know that, well, one, you are trusted resources for elected officials, and that also you are experiencing, and your employees and the communities you serve are experiencing the results of policy change. So we know that that partnership needs to be strong between the public and the private sectors. HPIO, as we're called, was founded by philanthropy back in 2003 because there was a core group of foundations who believed that there was a need for an organization like ours. Most of our funding continues to come from philanthropy and through businesses that invest in our work. But we have also been engaged by state government for a number of projects. The most recent project that we participated in with state government was the facilitation of the final report for Governor DeWine's Minority Health Strike Force. And we're going to mention that a little bit later in the presentation. That came out over the summer. We do hope that this is a conversation. We have a lot of information to share, but we invite you to type questions and comments in the chat box, and we will pause occasionally to maybe highlight a few comments or respond to questions. We have 3 objectives for our time together this afternoon. The first is that we're going to share some data around racial disparities in Ohio. Some of that data you may be familiar with already. Some of it may be surprising to you. We're going to talk also then about the connections that are backed up by research and evidence between racism and health. And you'll see that there are both direct and indirect connections between the two. And then last, we're going to talk about a framework for action. And our hope is not that we answer all questions. We know that we do not have all of the solutions, but we hope that it catalyzes some new thinking and maybe a few new ideas for you to consider in your companies. That the data and the research is clear that racism is a systemic and ongoing public health crisis with serious consequences for the health of Ohioans. While we're going to start with laying a foundation based in data and evidence, we're going to end with taking a deeper dive into this framework for action. So let's start though with that foundation. HPIO produces the Health Value Dashboard every 2 years, analyzing over 100 measures so that policymakers and others know how Ohio compares to other states and whether we're moving in the right direction toward improved population health and sustainable healthcare spending. This is our work on the dashboard is where we began, and you'll see that we, through our analysis, found that there were numerous troubling disparities and inequities in our state, and that data is then what has fueled our journey over the last several years. Ohio, according to our analysis, ranks 46th or near the bottom compared to all 50 states in the rest of the states and the District of Columbia on health value. We spend more than many other states on what we call downstream healthcare, and we have poor health outcomes. Researchers in the United States have estimated the extent to which various factors influence our health. And you mentioned that that some of you heard a presentation about a year ago related to the social determinants of health. And for those of you who are a part of that discussion, this won't be surprising to you. You may have seen a similar diagram as this one. But what we know is that while clinical care is necessary for health, and it's certainly necessary if you have a health condition, if you have an accident or injury, that alone is not sufficient to achieving overall health. The social, economic, and physical environments, which are often called the social determinants or social drivers of health, are much more significant contributors to our overall health. And we also know that while our health behaviors do also contribute to our health, those behaviors and choices we make are either supported or inhibited by the systems and environments in which we live. So, I think I often take for granted the fact that I can go out in my neighborhood and walk any time of the day or night and feel safe in my neighborhood. I know that that is not the case for many people, though. We often underestimate the role that those systems and environments play in our health. And then we also recognize that the inequities that we see in the data are driven by racism and other forms of discrimination. So looking at the dashboard data, and the dashboard, to be clear, looks not only at population health outcomes and spending related outcomes, but we also look at measures related to all of those systems and environments that influence our health. We perform in Ohio relatively well on access to care, but we perform very poorly on all of the other systems and environments that impact our health. The data, and we're going to focus, there's three main reasons why we perform so poorly on health value. We're going to focus on the first one in today's presentation. And of course, we have much more information to share and could share in a longer session on the other two reasons too. But when we look at the data, particularly the data broken down by race and ethnicity, we learn that one of the reasons we rank so poorly is that too many Ohioans are left behind. When possible, we estimated the number of people who would be impacted if the disparity between the group with the worst outcomes and the best outcomes was eliminated. Looking at the data this way reminds us that there are people who are impacted by these disparities and inequities, and not all Ohioans have the same opportunity to be healthy. So now Reem is going to share some additional specific examples about racial disparities, or examples of racial disparities, and then she's going to also discuss more fully the clear, direct, and indirect connections between racism and health.
Thank you, Amy, and it's a pleasure to join all of you this afternoon. As Amy shared, I'm going to dive deeper into Ohio's racial disparities just to first lay a foundation for the impacts of racism, and then we'll dive into opportunities to take action. Across the state, there's a gap of more than 29 years in life expectancy in Ohio, depending on where a person lives. And this map that you see here shows the top and bottom census tracts for life expectancy in the state, with life expectancy ranging from a low of 60 years in the Franklinton neighborhood of Columbus and Franklin County, and then to a high of more than 89 years in the Stowe area, which is in Summit County. You can be living in the same county in Ohio, maybe even in the same city, and the life expectancy in your neighborhood may be drastically different than the life expectancy in a neighborhood that's just a few miles away. When HPIO examined these census tracts with the highest life expectancy and then those with the lowest life expectancy, an interesting pattern emerged. What we found was that the census tracts with the lowest life expectancy had a higher percent than the state average of Ohioans with a disability, as well as Ohioans who did not graduate high school. And the average income in these neighborhoods was less than half of the state household median income. And the census tracts with the lowest life expectancy had a higher percentage than the state average of Ohioans of color, particularly Black or African American Ohioans. When we think about what this means and look at the data, it shows that on average, Black Ohioans are expected to live 4 years less than white Ohioans. And then even more disturbing, a measure that I'm sure you've heard before, Black infants in our state are dying at a rate that is 2.5 times greater than the rate for white infants and 2 times greater than the state's overall rate of infant mortality. The health disparities and inequities experienced by communities of color have really only exacerbated gaps in outcomes during the COVID-19 pandemic. And the figure that you see here compares COVID-19 cases, hospitalizations, and deaths for Black and white Ohioans relative to their proportions of the state's total population. What this shows is that our Black community in Ohio is overrepresented across COVID-19 cases, hospitalizations, and deaths. So for example, Black or African American Ohioans account for 14% of the state's population, but make up more than 26% of COVID-19 hospitalizations. And on the other hand, white Ohioans make up about 83% of the state's population, but then less than 61% of COVID-19 hospitalizations. Another deeply troubling data point is that Black or African American Ohioan COVID-19 deaths have already surpassed total deaths in 2018 from several other leading causes. And with these numbers only increasing, COVID-19 is likely to become a top 3 leading cause of death for Black or African American Ohioans in 2020. The impacts of COVID-19 have really only emphasized that we are moving in the wrong direction as a state, and that the gaps in outcomes we have been seeing for decades, for hundreds of years in communities of color are only going to widen. We term COVID-19 disparities, like the many other disparities that we see being experienced by communities of color, as really just the tip of the iceberg. They're indicators of what are more deep-seated issues that must be addressed. And as you've heard now said several times, the research evidence is clear that racism is a primary driver of these gaps in outcomes experienced by communities of color. I want to pause here for a second to emphasize that the gaps in outcomes faced by Ohioans of color, and specifically by our Black and African American community around COVID-19 and other health outcomes, are not a result of differences in behaviors. They are not a result of genetics. The evidence demonstrates that these gaps in outcomes are the result of hundreds of years of racist policies, practices, systems, and beliefs. And I want to pause here and invite you to comment in the question box on anything that has surprised or motivated you from previous slides that we've covered, or encourage you to add any comments or questions on the slides to come. And I'll just pause for a moment to see, Amy, if there are any questions that we can answer so far, any comments. I don't see any.
I don't see any quite yet.
Okay, great. Well, if you haven't already, please do share your comments or your thoughts on what you've heard so far, and we're looking forward to having a more robust discussion. As we've seen over recent months, the link between racism and health is really grabbing the nation's attention, particularly as we've seen how COVID-19 is impacting communities of color, and in light of protests and public calls to address racism and police brutality following the recent deaths of George Floyd, Breonna Taylor, and Ahmaud Arbery, among many others. As Amy mentioned earlier, HPIO recently released a brief that goes into detail on the relationship between racism and health. And one thing that we've found is that it's important to have a clear and firm understanding of the connections between racism and the poor outcomes experienced by communities of color, to then be able to identify action steps you can take within your organization to disrupt and dismantle those connections. In talking about racism, we find that it's important to also understand the levels at which racism operates. And what you see here is Race Forward's 4 levels of racism framework, which we found to be a useful tool that others can use as well to better understand how racism is taking shape within our society. When we talk about racism, there are 4 levels, and we'll start with internalized racism, that bottom rung, which describes an individual's privately held beliefs of prejudice, oppression, and privilege regarding their race or the race of others. And this might include feelings of white superiority, or a person of color's feelings of inferiority. So, for example, a person of color may have negative views of their skin color or features because they are held to white standards of beauty. And then conversely, a person who is white may hold their whiteness as superior to or more attractive than a person of color. Interpersonal racism, that next rung, describes when individuals, through their interactions with one another, act on these beliefs of racial prejudice, stereotype, oppression, or privilege. This can be both direct and indirect through unfair treatment, bias, or violence. And this rung or level of racism is really what's most commonly thought of when we have discussions of racism. Then there is institutional racism, which is when beliefs of racial prejudice, oppression, or privilege are acted on or perpetuated by institutions or organizations. And this is, as an example, where we see fewer people of color being hired or promoted within an organization. And then we have structural racism, which occurs within and across systems in society. And structural racism leads to things like disinvestment from communities of color through historical practices of residential redlining, and even present-day gentrification. We find that most conversations on racism focus on that individual level, so that the interpersonal level. However, systemic racism, that institutional or structural level of racism, is really an even more pervasive driver of the poor outcomes faced by communities of color. The figure that you see here now outlines the relationship between racism and health, and the connections, as you can see, are incredibly complex and interwoven. Racism impacts health both directly and indirectly through exposure to traumatic events, violence, toxic stress and stigma, having an increased risk for participating in unhealthy behaviors, and policy and system inequities. I'd like to break this down a bit more for you. So first, I want to provide an example of how racism through trauma and toxic stress impacts the health of communities of color. Toxic stress, when we talk about toxic stress, really results from what is termed a prolonged activation of your body's fight or flight stress response system. And that can be caused by experiencing traumatic events in life, which include experiencing racism or racial microaggressions. National data indicates that Black children are 9 times more likely than white children to be treated unfairly due to their race, 9 times more. What research tells us is that repeated exposure to trauma or racism can lead to physiological changes to the body that cause a wear and tear effect on a person's nervous, endocrine, and immune systems. And over time, as you can imagine, this wear and tear effect contributes to poor health outcomes, things like high blood pressure, heart disease, stroke, depression, even premature death. People who are exposed to chronic racism are also more likely to engage in unhealthy behaviors as a way to cope with the trauma and toxic stress that they are experiencing. And engaging in unhealthy behaviors can actually even have a protective effect on a person's mental health in the short run. However, of course, as we all know, engaging in unhealthy behaviors like not eating healthy or smoking are significant contributors to poor health outcomes. This graphic on your left shows that the more trauma a person experiences early in life, the more likely they are to smoke. Traumas like experiencing racism, being exposed to chronic racism. And then to illustrate the impact of this, on the right, you see a bar chart that shows that middle-aged Ohioans who are Black are twice more likely to smoke than white Ohioans. Racism also leads to policy and system inequities, which would then contribute to poor health outcomes for communities of color. So for example, data demonstrates that communities of color face implicit biases and racial discrimination within the healthcare system, and that they're underrepresented in the healthcare workforce. Black patients were often denied treatment in the past because of their race and were subject to racist and unethical medical research practices, like the Tuskegee study, which is the picture that you see here. And that was an experiment of untreated syphilis in Black men that lasted 40 years. Even in clinical care today, studies have found that many white physicians implicitly, so not with conscious knowledge, hold anti-Black beliefs. This may manifest in things like writing off some of the health concerns and questions of patients of color, or not taking their complaints of pain as seriously. A survey in 2016, so relatively recently, found that 58% of medical trainees incorrectly believed that Black skin was actually thicker than white skin. For these reasons, people of color have an understandable mistrust of and are much less likely to engage with the healthcare system. A recent National Kaiser survey found that nearly 6 in 10 African Americans do not have trust in the healthcare system to do what is right for their communities. We also see these policy and system inequities embedded within the criminal justice system, dating back to slavery, Black codes, and convict leasing. Black codes were criminal codes meant to restrict the activities of African Americans, And then convict leasing was the practice of leasing incarcerated people to plantations and factories after the Civil War. These inequities within the criminal justice system are also rooted in more recent history, including the war on drugs. And from the 1960s to the 1990s, there was bipartisan support for a series of tough on crime policies. And these policies resulted in dramatic growth of our prison population, often called mass incarceration, and that disproportionately impacted men of color. Nationally and in Ohio, Black or African American people are incarcerated in state prisons at more than 5 times the rate of white people. And despite the large disparities in drug crime arrests by race, what you'll see is that drug use and addiction prevalence are actually quite similar across racial and ethnic groups. And when we talk about inequities in the criminal justice system, they do have widespread impacts. Incarceration limits opportunities to health for people of color through increased exposure to trauma, disease, chronic stress, social stigma, exclusion, but they also create barriers to accessing employment and even accessing quality and affordable housing. And that can have a rippling effect, not just on the health of that individual, but can impact the financial and social stability of their families and communities. Just a quick check-in here again to see if there were any comments or questions. Again, encouraging you, if you haven't already, to put those into the question and chat box, and we'll have a more facilitated dialogue and discussion in just a bit. Now, getting to probably the part that you are all waiting for, racism has put in place and maintained obstacles to health for communities of color in the U.S. for more than 400 years. And we know that work to address the cumulative impact of historical and present-day racism is daunting. And as you heard from Alex earlier, improvement is possible, but it takes time and there needs to be sustained action. There are actions that we can all take. Amy shared this framework earlier. It's a framework that HPO created adapting from the 4 levels of racism framework that I shared earlier. And it outlines how individuals and groups, public and private organizations, and state and local government leaders can work to eliminate racism in all its forms and advance equity. At each level of this framework, the ultimate goal is to eliminate racist beliefs, acts, policies, practices, and structures, and to extend leadership and power with communities of color. There are also action steps associated with the diagram, specific action steps that you see here that all Ohioans, public and private organizations, and state and local government entities can act on to eliminate racism. It's critical that these themes are acted on and sustained over time. And Amy and I are going to review some of these key themes outlined here that businesses can take, but we'll make available to you the framework and these action steps to you following the webinar as well. A necessary first step is to acknowledge racism as a crisis. And many of your organizations signed on to support a resolution to Columbus City Council that declares racism a public health crisis. This is wonderful and can be strengthened by ensuring that your organization also has a specific statement acknowledging the need to dismantle racism and address its impacts. And that acknowledgement can be embedded within the mission and vision statements within your organization. It's also important that if you're including statements, that they move beyond references to diversity, equity, and inclusion, and explicitly name racism. This sets a level of honesty accountability and transparency that is really important to authentically engage in equity conversations. You can also look at ways to support recruitment, promotion, and retention of diverse leadership and staff, as I know many of your organizations are already doing. And these efforts often must go beyond what are considered traditional strategies and do require a critical look at your workforce pipeline. Another action step is providing leadership, staff, and even clients with cultural and linguistic competency and cultural humility trainings and resources. With each of these action steps, it's also important that specific targets are set and progress is tracked over time. So here you see two examples of setting objectives. One is focused on the percent of organizational leadership who is Black, and the other on the percent of employees who have participated in anti-racism trainings. You'll note that short, intermediate, and long-term targets are set, and then progress can be tracked over time. Now I'm going to hand it back to Amy to highlight the last key action steps and then close out our presentation with discussion.
Well, since the name of our organization is the Health Policy Institute of Ohio, it won't surprise you that we're very interested and invested. In fact, it's our mission to focus on policy change. To build on Reem's remarks, we want to talk a little bit more deeply about how you as private sector leaders can be partners in advocating for, implementing, and funding anti-racist policies, programs, and practices, both within your companies and then through using your positions and communities to influence public policy. So we'll often differentiate between small p policy and big P policy, and there's opportunities in both. We know that you are already doing a lot. I mean, even the fact that you're on the webinar today demonstrates that you are invested in this work. And some of the thoughts that we offer up may not be relevant, but we're offering them up in the hopes that they may spark some additional ideas for you and maybe give you some food for thought that you can then explore more fully within your companies. So talking first about that kind of small p policy, and I think Reem has already touched on some of these themes, but within your company or the organizations in which you're working, you can bring together your boards, your executive teams, and other leaders to explore the opportunities that are highlighted in the action framework, and ask yourselves some critical, internally focused policy questions, like how can we fully support the health and well-being of our employees, particularly employees of color? Are our strategic and business plans being implemented using an anti-racist lens? What actions have we already taken? How do we know whether they're successful or not? And how are we investing in and providing services to communities of color? There may be some additional opportunities to take action. I'm going to give you just a second to review this list, and then I'm going to highlight a few of them. We can always discuss these more in a little bit once we get to discussion. There could be opportunities to impact racism through your healthcare purchasing decisions and the conversations you have with your third-party administrators and insurance providers. You can request data regarding the diversity of the healthcare providers in your network. And you can further racial justice initiatives through your corporate philanthropy. There are also many opportunities for you as business leaders to combat racism through policies in the public sector. As we've discussed today, public policy has persistent and pervasive impacts. And we know that corporate leaders can be powerful allies and influencers of public policy. The documents that are on this slide are relatively recent documents, and we assisted state government with the creation of the first two, the State Health Improvement Plan and the Minority Health Strike Force final report or blueprint. The last document here, which is Ohio's executive response to the Minority Health Strike Force blueprint, is the response of Governor DeWine's administration in terms of their commitments in taking action on the final blueprint. There was a question posed in the chat box about what policy changes are taking place in Ohio to change outcomes for people of color. And the interesting thing about the blueprint for the Minority Health Strike Force is that while it was the strike force itself was brought together by the governor in light of the very disturbing disparities we've seen in COVID-19 related cases, deaths, and hospitalizations. But what the administration wanted to see were opportunities to go broader and impact the systemic issues that are influencing those disparities. So of course the administration is taking many short-term, or I should say immediate steps to address those disparities, but they wanted to cast that broader net to get into those hard conversations about the root causes of those disparities. In laying forth that executive response, it gives an indication of where the administration is focusing their efforts on addressing those systemic issues. And all three of these documents, if you as private sector champions are interested in engaging more fully in policy change to address racism and eliminate disparities, there are many ideas in these documents that you could explore. To talk a little bit more about that, again, there are some critical questions for consideration in advancing public policy change. So, again, bringing together your executive teams, your leadership, your boards, and asking questions like, are you lobbying for specific public policies that advance equity? I certainly know that both the Ohio Business Roundtable and the Columbus Partnership does have a history for lobbying for policies related to education and healthcare reforms. There could be more opportunities to explore. Do leaders in the executive and legislative branches know that the issue of racism is important to you personally? Talking to legislators and other elected officials about your own personal journeys, what you've learned, the mistakes that you've made can be, very, very powerful. I mean, even just bringing up the topic and saying the word racism has power. And it's important for elected officials to know that these issues are important to you. Have you asked elected leaders to make similar commitments as to what you're making in your companies? to engage in implicit bias training, to participate in learning opportunities like the one we're all participating in today, and to have these hard conversations and dialogue. And then are you partnering with community leaders, particularly those in communities of color who have long advocated for anti-racist policies and practices? There's some additional public policy focused action steps that we like to offer up for your consideration. Again, I'll just pause here a second to let you read this list. To say a little bit more about the first one, even talking with elected officials about the information that we've shared with you today, sharing the racism and health brief, talking about what the data and the research evidence tells us, normalizing conversations about racism, and showing that you're comfortable with feeling uncomfortable about the historical facts that have led to disparities and inequities. Examining your government relations agenda through an anti-racist and equity lens. And then, of course, partnering and collaborating with others, other members of the Business Roundtable or the Columbus Partnership, on advocacy efforts aimed at eliminating racism and advancing equity. Wanted to highlight for all of you that we have lots of resources on our website, which is hpio.net. The full dashboard is available on our website, so you can dive deeper into that high-level information about health and healthcare spending in Ohio. We also have a resource page that includes a menu of anti-racism resources, such as training tools and other policy tools. And of course, we've likely not captured everything that's out there. So if you're aware of resources that we don't have on our website, please let us know, because we would be very interested in including that information. The resources that are marked with an O on the resource page are those that are most relevant for public and private organizations. So to close, we know that this is daunting work, and the data are indeed sobering. There's a lot more to be done, but we're hopeful. We've been particularly encouraged over the last several months to see so many state agency leaders, business leaders, health-related organizations making bold statements and commitments to action in light of the irrefutable evidence of the connections between racism and health. We're hopeful that these actions and these commitments will be sustained over time. I really liked what Alex said at the onset of our session today about how these are permanent conversations to have. It's not just commissioning a report, maybe acting on a few recommendations and then letting it go. That the work is cyclical, it's iterative. We learn, it was when we first developed that framework for action, it was a linear model, and we realized that this journey is not linear. We learn, perhaps through our own individual work, we contribute to our organization's actions, and then we learn more, and we might have to go back and do more individual work even before engaging in policy change or other activities. But we're hopeful again that through that sustained commitment that we will be able to advance equity for communities of color, both in our state and in our country. Thank you again for your attention. It's really wonderful that so many of you logged on today and that you're still on. And now we very much would like to engage in a conversation with all of you and hear from you, learn from you, hear what you're doing. So again, please type your questions in the question box, or if you would like or prefer to ask your question or make a comment or statement verbally, you can do that. You can raise your hand, and Reem is going to show you how to do that here on the next slide. Wow, the slides have worked all the way through except for right there. Okay, there we go. Raise your hand. And you know, we have a couple of questions that we'd like to throw up on the screen to spark the conversation. The first question we've already dove into, and we didn't see anybody saying that any of the data or information that we shared today was surprising. But if something has occurred to you that was shocking, surprising, particularly troubling, please make note of that in the question or the question box. And then we had two other questions for you, and those are what new actions is your company thinking of taking in efforts to dismantle racism and advance equity? And then the second is what policies, what public policies could your company support or advocate for in efforts to eliminate racism and advance equity?
So Amy, we do have some questions in the question box that we can start with first, and then definitely encourage all of you to respond to the discussion questions that you see here. We'd love to hear about the actions that you're taking within your organization, or what types of policies you're thinking about supporting or advocating for, or to what extent some of those action steps that I covered or Amy covered, you're already doing or thinking about doing. So we have lots of questions coming in, comments coming in. So let's start there first. So one of the questions is what African American community organizations are being engaged in the dialogue to ensure the community knows that these conversations are occurring. And I can start, and then Amy, please feel free to jump in. I think that depends really on who is conducting the conversation at the state level. There was a minority health strike force team that was assembled. As Amy noted, it was assembled by the governor originally with the intent to address COVID-19 disparities, but then their overall aim or purpose was brought in to address overall health disparities and inequities faced by communities of color. So there are representatives of communities of color on that strike force. And other organizations, I encourage you to go there for kind of lists of individuals or organizations that you could engage in these conversations as well. Other organizations that come to mind are urban leagues, also our faith communities that you can engage in these discussions as well. The Ohio State University College of Public Health also recently conducted a comprehensive needs assessment, and as part of that needs assessment, they have an appendix of organizations representing communities that have been systematically disadvantaged among those communities of color. And so that is something that we are also happy to share and forward to you.
I see another question about what are tangible ways that an employer can measure success in this important endeavor. And I think there's likely several ways that question could be answered. we're very fond of logic models at HPIO. So, I think this is often framed as starting with the end in mind. So being clear what your purpose or objective is as a company in relation to any pursuit, but in this case, in pursuit of eliminating racism, and then figuring out what you could measure to determine whether you're contributing through your activities to that end goal. I think Reem shared a couple of examples of SMART objectives that were related to a couple of items in the action steps, but that's not at all an exhaustive list. We organizationally just for all of our work, we have 50 some measures that we track regularly, and some of those are more output oriented. And so examples of outputs would be perhaps the number of training sessions you conduct, the number of implicit bias trainings that are offered in your company. But then, and it is important to track outputs, but then what we're all very much more interested in is the outcomes. So being very clear on what the outcomes are that you're aiming to achieve, and then structuring your measurement and evaluation so that you know whether you're contributing to that particular goal or objective.
Just to add on to Amy's point, I think it's really important to start with the end in mind, and those being outcomes, overall outcomes of communities of color. So for example, whether they be the number of African Americans within a particular area that have gained employment, so broader than just within your organization, and then walking back to what are some of those output or process measures that can contribute to that overall end outcome or goal. In the State Health Improvement Plan that Amy referenced, there are a series of outcome measures that can then be the end point or end goal of some of your efforts to dismantle racism and advance equity. We have another question around does your research and data break down by county and region? We get this question a lot. A lot of our data is focused at the state level since our primary audience is state policymakers, but there is some data that can be disaggregated by race, ethnicity at the county and region level. I would direct you to the state health assessment, which does provide some data disaggregated by race, ethnicity. Amy, other resources that you can think of?
No, well, just on that topic of local level data, related to our health value dashboard, there's a crosswalk posted on our website of data that's in the dashboard, and then which of those metrics are available at the local level. There's also the state health assessment, which is a document that's housed on the Ohio Department, or it's actually a web interface on the Ohio Department of Health's website, where some data is available at the local level too.
Okay. Another question on, has there been any studies specifically on the impact of the justice system on minority health? That is not an area that HPIO has yet focused on. We will be focusing on the intersection between the criminal justice system and health actually in the upcoming months, and the impacts of racism on the criminal justice system. But we could certainly follow up with studies that have taken a closer look at the impacts of the justice system on minority health. There are, I think, many that we could direct you to.
And I see someone typed in that their company is doing a company-wide training on unconscious bias for other leaders and managers. This person said that this is one of the actions that they're taking. in their company. So that's terrific. And it's a wonderful step to be taking.
There's a few comments here around the being pleased with the openness of the dialogue that's happening and occurring, and commending the honesty that's happening when having these conversations, and also highlighting that the real value will be in the lessons of the journey. So we certainly appreciate that comment as well from our organization's standpoint.
And I think that covers all of the questions and comments. We are happy to make the slides from today available. And as Reem indicated, we'll also make the brief available to all of you too. Again, thank you to the leadership of the Ohio Business Roundtable and the Columbus Partnership for inviting us to share this data and this information. And thank you to our friends at Byers Minton and Associates who facilitated the connection between us and the leadership of those two organizations. We're happy to continue to be a resource for all of you in this journey, again, with the caveat that we don't know all of the answers, we don't know all of the solutions, but we would be very interested in continuing to learn with you. Thank you again, and hope you all have a great afternoon.
Thank you, Amy.
Likewise, Amy and Reem, great presentation. Bill Byers, thank you for your leadership and connecting us all. And to everybody who participated, thank you for being willing to be a part of this journey, to be a part of these important conversations. And certainly there's so much more work, for the four of us in our organizations to do together, but everybody that is participating with us. Pat, appreciate your leadership.
Thank you, Alex. And we will certainly forward Amy and Reem any information or questions or comments that we get to both of you.
Sounds great.
Thank you.
Great.
Thank
you.
Take care.
Excellent work. Very well done. Thank you.
Bye.
You bet. Thank you. Bye-bye.